More, ladies and gentlemen, very warm welcome and a good morning. I'm really happy that so many people registered to our webinar. My name is Marzena Kordaczuk-Was. I'm representing Polish Platform for Homeland Security, and I have a pleasure to be the coordinator of Indeed project. Indeed project, just in a few words, Indeed project is it's initiative which is focused on the evidence-based evaluation related to prevention and mitigation of radicalization. So today we are meeting in relation to the topic of designing evidence-based practice in the form of a comprehensive long-term preventive program. I will share today my own experiences in relation to the mentioned designing of the preventive measure, but particularly today I will be focused on long-term comprehensive preventive program as it was indicated in the title. I would like to ask to mute your microphones. Probably, Marzena, you are unmuted.
Tak.
Somebody is unmuted. So if you could mute your microphones, dear colleagues. Oh, thank you very much. So just additional word that this webinar was planned as an event for the colleagues from the consortium of Indeed project. However, I'm very glad that we also have today the guests from outside of the consortium. So I hope that it will be useful for you to hear how I designed a long-term comprehensive program which is implemented by Polish Platform for Homeland Security and is dedicated to the prevention of radicalization leading to the discrimination and the hate crime. Today, this is the first event. Today, I will introduce you more to the preparatory stage and the first steps of the preparation of mentioned program. And as a follow-up, we already planned two additional webinars. One will be implemented on 25th of July, and it will be dedicated to the formulating of the standardized assumptions of the preventive program. Actually, it will be continuation of today's meeting, and then the third one is already set for 22nd of August and will be dedicated to the evaluating of evidence-based preventive program, also as a follow-up, as a continuation of today's event and the second webinar set for 25th of July. As this process of preparation, process of designing of the comprehensive preventive program is quite complex, so I didn't want to squeeze everything in one very short webinar because it would be not enough time to do this, and also we wanted to avoid, the keeping you very long, like the whole day webinar. This is why we decided to set three events dedicated to this topic of designing evidence-based practice. As I already mentioned, today I will use as an example the long-term comprehensive program, educational program with the title Understand, Respect. This is the program which is aiming in the preventing of radicalization leading to discrimination and the hate speech, because this phenomena are typical for the Polish environment, and I will show you how this comprehensive program was designed as an evidence-based practice. I will only add that this program is already after the phase of formative evaluation. It means it was already implemented in the pilot version, and currently we are working on the revision of the assumptions of this project, and then it will be it will be continued as a proper implementation of 3 years comprehensive preventive program. So I have a great pleasure to be an author of this particular initiative. As for more than 20 years, I'm involved. I'm focused and I'm working in the field of the prevention of the last year's prevention of radicalization, leading to mostly to the discrimination and the hate speech, which is typical for Poland, but not only. And I had the pleasure to be for nearly 20 years. Yeah, actually, precisely speaking, 18 years. I was involved in the preventive actions, preventive initiatives designed and implemented and co-implemented by the Polish police, as I was a police officer. And kind of national coordinator of the preventive measures for some time. But at the same time, I'm also PhD in social sciences. So I'm trying to combine in one person the experience from first line practice, because I'm a practitioner dealing with a PVE, CVE, and also my scientific expertise. And today, as I already said, I will try to share with you my own experience in this domain. The only maybe additional information would be needed in relation to Indeed project, why we organized this webinar. I already mentioned briefly that Indeed project is focused on the evidence-based evaluation of PVE, CVE, and the radicalization initiatives, those initiatives which should prevent or at least mitigate radicalization leading to violent extremism. And but we are also focused in our project on the whole process of designing evidence-based practice, as the evaluation is for us one of the step in the logical model of the creation of the designing of the preparation of assumptions of the evidence-based practice. So this is why we are working on we are collecting currently the approaches, the method, the tools dedicated to the evidence-based evaluation. However, at the same time, we are also gathering information on the process of designing evidence-based practices. So me, as a representative of Polish Platform for Homeland Security, which is the coordinator of Indeed project, we decided to also to share our experience, our good practice, and to show you how we approach to the creation and the implementation of the evidence-based practice. So briefly about the structure of my today's presentation. In the beginning, very briefly, I will be focused on the what for us the evidence-based approach to practice means, and then I will show you logical model of our preventive program Understand Respect. Then I will show you how the step of the preparation of the theoretical foundation of our program. And then I will be a bit focused on the diagnosis of the radicalization risk, which was conducted in Poland, and we were checking the current situation, the risk, the level of risk of radicalization in the Polish schools and the local environments. Because this diagnosis was the basis for the designing of all assumptions of our program Understand Respect. This is not as I already mentioned, this is not the whole process of the designing of our program. Actually, the assumptions of the program will be indeed as the creation, the designing, the programming, and the planning of all assumptions of our program will be presented by me during the second webinar. However, without this mentioned, without the thinking about the logical model of our program, and without the setting the theoretical foundation for our program, as well as without a detailed diagnosis of the radicalization risk, we wouldn't be able to design the evidence-based long-term comprehensive program. This is why today I'm starting with this, with those stages of the designing process. So let me, in the beginning, because in the title, and I already at least a few times mentioned about the evidence-based approach to practice, about the evidence-based practices. So let me explain you what, how we in the Untitled consortium, how we understand evidence-based approach to practice, because currently we are in the process of gathering the all available research, but also practical informations related to evidence-based approach to prevention and countering of PVE, and also to radicalization. And we are really thinking how to define, because we see from the literature and also from practice that this evidence-based approach can be understood slightly different. So in Untitled consortium, Untitled project, we understand, at least initially, on the stage of the preparation of our proposal, we thought about this evidence-based approach as a kind of combining the individual practitioner's expertise with the best external evidence which is available from the published research, and this combining of the theory and the practice is needed in our opinion to make effective decisions about what to do to efficiently respond to the diagnosed problem. It means the security threat. So for us, in our consortium, evidence-based approach to practice means the transfer of research results to the practice, and it means that we are focused on the practical activities implemented by first-line practitioners. However, the activities which are based on the scientific knowledge. On the slide, I also put the definition of evidence-based practice, which is deriving from the medicine, and it says that evidence-based practice is a process used to review, but also analyze and to translate the latest scientific evidence. And what is very important in this definition, that the goal of this evidence practice is to quickly incorporate, as I already mentioned, the best available research along with the clinical experience. But this definition is also focused on the patient's preferences. So this is why I put this this definition on the slide, because in this case, in the case of definition deriving from the medicine, the patient preference is very important, because it's giving the opportunity to clinical practice to respond, to prepare them to take a decision which are focused, which are patient oriented. So very similarly in the area of the prevention of the security threat, the needs of the addressees, the needs of the recipients of our actions are very, very important, because the evidence-based practice should combine the expertise, practical expertise and research, but also has to be focused on the real needs of the recipients and the local environments. One more maybe not definition, but a way of understanding of evidence-based approach to practice is deriving from the study which was conducted by me in 2020-2021 among the first-line practitioners and policymakers cooperating with cooperating with the radicalization awareness network working groups. It was more complex study, but one research question was related to understanding and to understanding by the first line practitioners and policymakers of evidence-based approach to practice. I asked respondents if evidence-based practice means for them, only the practice which is evaluated during the implementation and after. It means is checked to be effective, or it means also for them the being focused on the evidence coming from the research already during the stage of the preparation of the program or other preventive measure. And actually nearly 70% of them, they confirmed, they said that they think that the evidence-based practice means the combination of those two perspectives. So it's not thinking about the evidence-based practice. We should not only be focused on the evaluation of the results of this practice, which is very often this is the very often reality that talking about the evidence-based practice, we're very often thinking about the checking the results of the practice, but they confirm that we should also design the thing during the whole designing process about the available evidence from research, which can help us to create, to program, to design the preventive program or other measure which is grounded in a science, in the strong evidence from science, and also a focus on the recipients, potential recipients' needs. So it was very important for me to ask about this. Because it's the results from the study confirmed what we were already doing in PPHS, designing the program already mentioned by me a few times, long-term program dedicated to the prevention of radicalization leading to discrimination and the hate crime. So before I will go to the process of designing, process of the preparation for the designing of our program, I will tell you what we mean under this term long-term preventive program, because also in our Indeed consortium we see that in different member states, in different parts of Europe, and on the European level, we can understand initiatives in the different way. So actually, in our program, in our project, we divided PVE, CVE, and the radicalization initiatives into 4 categories. One is dedicated to policies and strategies. One is dedicated to the long-term preventive programs. And third one is dedicated to the short-term actions. And the fourth one is dedicated to ad hoc interventions. And today, as I'm presenting you the example of the designing process of long-term preventive program, so let me be focused on this, maybe not definition, but explanation, what I think, what we think in PPHS, talking about our good practice, which is called long-term comprehensive preventive program. So long-term program for us, it's, as I mentioned, a comprehensive initiative, which is purposely programmed, and all elements or all standards of these initiatives are integrated, and they are deriving from scientifically proven preventive strategies, which are aimed at stopping, in the best meaning, the stopping of the security threat, but if it's not possible, so at least aimed in reducing the diagnosed threat. And but the very important is that in the program we are we are focused on the prevention or mitigation of the security threat, which is diagnosed in the local environment by influencing the real, it means diagnose causes, the roots of this threat. So this is very important. I'm emphasizing it because what I observed within that more than 20 years already dealing with the preventive measures, that quite often authors of the preventive programs, they are focused on the threat. However, they are not really focused on the causes, on the roots of the diagnosed threat. So it means that they are trying to influence, the phenomenon occurring in the local environment. However, without influencing the roots, the causes, why this phenomenon occurred in the local environment, is not possible to efficiently prevent or to avoid the evolving of this diagnosed threat. So this is very important for the long-term preventive program, that the program is programmed based on the standardized elements which are designed on the basis of the implemented diagnosis of the threat, but also the causes, the causes of the roots of diagnosed threat. As I mentioned, the long-term preventive program is based on the standardized assumptions and the specific elements which has to be filled in the building, in the structure of the program, to call the initiative and to treat the initiative as a long-term comprehensive program. I will tell you more about those elements, those standard assumptions and the elements a bit later. But what is also important in the long-term preventive program, that this program is responses to the community needs. I already mentioned that this is why it's so important in general in evidence-based approach to practice, be really focused on what community needs and to respond and to try to influence the diagnosed threat also from the perspective of the needs and of the community. And one more very important thing, that the long-term preventive program is considering the risk, but also protective factors on all levels, individual, relationship, institutional, and the community, and also societal levels. And long-term preventive program can be implemented at the universal, selective, or indicative. It means the primary, secondary, or tertiary level of prevention. Okay, so let me go now to the process of how a long-term comprehensive program titled Understand Respect was designed. So as the basis, as the preparation for the process of designing, was the whole concept was grounded and actually started from the thinking about the logical model of the program. Our program, Understand Respect, is based on the logical model. Logical model is it can be explained as a kind of a visual snapshot, which illustrates graphically the various stages and the various steps taken during the preparation, the designing of the program. And this graphical illustration also showing the each step taken during the process, however also illustrating the relationship between the individual elements. And a logical model is a logical model I use in my practice. I use this term logical model, but a logical model is also called with the other names, with a similar concept, and among them you can find the plan, you can find a model of change, a theory of operation of a theory of change. However, they are the definitions, the terms with a similar concept, similar meaning. But I will be using during my presentation, I will be using the term logical model. So why I use this logical model in the during the designing, the process of designing of a long-term comprehensive program, because the illustrating graphically the all steps, this is the one thing. Easily speaking, is simply speaking, it's easier for me as an author of the program to put on the paper all steps which has to be taken during the whole process, and to see what was already done and what is needed to be done in the whole process. But very important thing is that that seeing this logical model as a one chain of steps, I would say, also enables kind of very deep, very detailed reflection. What should be done and why we are designing the assumptions of the program in the specific way, but also it's used for the justification of the solutions which were proposed as a integral elements of the structure of the program. So because logical model explain, and each step included in this logical model of the program preparation, the program designing, explaining why the specific goals of the program were formulated by us, why we selected the specific strategies, of why we planned the specific preventive tasks, and this model, this logical model also allows us, to provide a very clear description of the program assumptions. So we see what kind of elements our program is consisted of. And but also it's showing the assumptions of the program, but also this logical model, and showing illustrating the mechanism of the operation between the elements, between the assumptions, and kind of, but also showing the methods used for the implementation and measuring the progress in achieving of our intended goals. So this logical model allows us to identify, to detect those assumptions which are not correct, and which are, for example, inappropriate or maybe unrealistic or simply wrong. And this logical model, following the logical model, both in the stage of the designing of the program and during the program implementation, allows us to monitor the assumptions of the program, and when it's needed, it allows also to correct it systematically. And one more very important thing, why logical model is so much needed, and why the long-term comprehensive program should be designed on the basis of logical model, is that showing the kind of illustration, kind of snapshot of our program to our partner entities, promotes and also allow us to understand us as authors, but also invited partners to understand what we want to achieve, and how we want to achieve, what kind of task we have to implement, and what is the mechanism of the program, what is the mechanism of the monitoring of the implementation and the progress of the program. But also it allows to go through very easily through the assumptions of the program, and to reach the kind of consensus between the partners in the terms of the implementation and implementation of the tasks which were planned in the structure of the program, but also if it's needed, also to discuss and to introduce the necessary changes to the assumptions of our program. So this is an understanding of a logical model which was used in during the on the basis of this logical model. Program understand respect was designed. And I mentioned the logical model is the process. Is a picture of the steps of the stages taken during the designing the process of program designing. So, in our case, in the case of our program, the whole process was generally divided into three main stages. The stage number one was dedicated to the preparation of the theoretical background of the program, because, as it was already mentioned, our program was intended to be designed as an evidence-based practice. So very important stage was to prepare the theoretical background of the program to ground the all works and assumptions, finally the assumptions of the program on the scientific background. And then the second stage of the process of designing was dedicated to the conduction of the diagnosis of the risk of radicalization, which was implemented in Poland, and but with a focus on the two environments, on the school environment and also on the local environment. And then the stage number three was dedicated to the developing of the assumptions of our preventive program, which aims to prevent radicalization leading to discrimination and hate speech. Very important is, before I will show you how. I will describe you very briefly how the preparation, how the works in each stage look like. I would like to add that those three main stages mentioned by me, of course, they are additionally divided into small steps. So I will show you the steps which were taken by me during the designing of the long-term preventive program implemented by PPHS. So before I will show you the steps taken during the stage one, I will just emphasize that the result of the stage number one was the preparation of the theoretical basis of our evidence-based program. Because, as I mentioned in the beginning, talking about the approaches, about the understanding of evidence-based practice, so the preparation of evidence-based program, the program which is based on scientific foundation required thinking about the adoption of the selection and then adoption of the proper paradigm, because this paradigm will automatically lead us through the process of selection of the proper theories and the concepts and the strategies program in our initiatives, but also will allow us to prepare the methodological workshop, including the methods and also the techniques and the research tools, which will be necessary for us, necessary on the one hand, but also appropriate from the whole process of the program designing. But not only, because they will assist us, that during the process, they will be used by us during the whole process of designing of the initiative. However, also they will be used also during during the implementation phase of the implementation of the program. So this is why the grounding, the building the theoretical basis for the evidence-based program is so important. This is why we did also this in program designing the program Understand Respect. So the stage one, it means the process of preparation of the theoretical background of the program was divided into 3 steps. In the first step, the sociology, the first step was dedicated to the thinking and to the selection of the discipline of science in which our program will be grounded. And I selected for our program the sociology, because for me the preventive measures are can be defined as a human actions and the human activities, and I see them as a fragment of the larger wholes, which are composed of the groups of people which are linked between them by the mutual dependencies. And then and actually I'm the PhD in social sciences, precisely speaking in sociology of security. So this discipline of science is very close to me, and I'm familiar with sociology, and really I'm convinced very strongly that grounding a preventive measure in sociology is justified. So then, choosing the sociology as a science, we were ready to go to the step number 2, and the thinking about the concept and about the paradigm, which will put the frame for the preparation of on the methodological workshop already mentioned by me. So, in our case, in case of PPHS program, I choose the concept of relational sociology. Additionally deepened by the paradigm of the critical realism, because this concept, this paradigm encourages to the deep reflection and kind of rebuilding from the roots, both on the one hand, the thinking about the preventive actions, but also implementing, creating, and the implementation of preventive actions. This the functional paradigm, in my opinion, allows to perceive those standard elements of the program, structure, and as those elements which having the specific functions, those standard elements of the structure of the program determine the quality of effectiveness of the preventive measures. So this is why I was focused in the preparation of the theoretical background on this concept and this particular paradigm. And then building this frame, this scientific methodological frame, I was able to select and to prepare, to select the methods and the techniques which are grounded in the methodology of social science, and those methods and techniques which will be used during the designing of the not will be used. Actually, they were used during the designing of the program by me as an author, and also my colleagues who were working with me on the specific task, the preparation of the planning of the specific preventive task. But also during the implementation of the pilot edition of our program by the implementers. And also those methods and the techniques were used by evaluator during this formative evaluation stage, but also will be during the monitoring the progress of the program, and they will be also used by the evaluator in the purpose of the evaluation of the results of our program. So the whole stage of preparation of the theoretical background of program Understand, Respect was divided into those three steps. Of course, as I mentioned, I selected the sociology. However, it depends on the author and of the program, which discipline will be selected as a basis, as a ground for the preparation and implementation of preventive measure. It can be also criminology, which quite often happens in the area of the creation and implementation of the preventive measures. And then having this this stage of preparation of theoretical background already finalized, it was possible to move to the stage number 2. Stage number 2, as I already mentioned, was dedicated to the implementation of diagnosis of risk of radicalization occurring currently at schools and also in local environments in Poland. Showing you, talking briefly about the understanding of evidence-based practice, I mentioned actually showing you on the slide this definition deriving from the medicine. I emphasize this patient need, patient preferences. So designing the program which aims to respond the real social needs needed from us to be focused on gathering the knowledge. On the one hand, gathering the knowledge about the problem occurring in the local environment, and the security threat which we are aiming to deal during the implementation and during the implementation of our program. So, long story short, on the one hand, we have to be focused. We have to check what is really what are the social needs in relation to the risk, which we want to respond with our preventive measure. And so the decision about the preparation of the measure, in our case of the long-term comprehensive program, should be grounded in the result from the preferably scientifically confirmed process, and based on up-to-date information on the current threats occurring in the local environment. So because this kind of detailed and the precise definition, but also description of the problem is the key has the key importance for the future decision which will be made by us during the whole process of program designing. This is why also in our case we decided before starting the work on the assumptions of our program, we decided to conduct this detailed diagnosis, because on the one hand, of course, from the first-line practitioners' experience and dealing many years in the field of the PVEE and CVE, we were convinced in PPHS that there is the urgent need to design this kind of program in Poland, because from our experience, from our observations, but also from the research, we knew that there is the lack of this kind of comprehensive long-term activity which should be implemented in the area of prevention of radicalization. But this radicalization, which is typical for the Polish reality, it means radicalization leading to discrimination and the hate speech. So on the one hand, we had our expertise, and we were convinced that it is needed to prepare this kind of product to be implemented in the local environments. However, bearing in mind at the same time that we are aiming to prepare the evidence-based practice, we knew that we have to combine this first-line practitioners' expertise and the knowledge with the result of scientifically confirmed results. So this is why we programmed and implemented diagnosis of the risk of radicalization, because we wanted to see if currently, of course, in the period of this diagnosis implementation, that the potential recipients of this program, if they will confirm that they see also the necessity, they see the problem of the manifestations of radicalization leading to discrimination and the hate speech occurring in their schools and local environments, but also if they will confirm that the program, that the designing of long-term comprehensive program in this area is really needed. So as I said, the second stage of our logical model was dedicated to the implementation, to the preparation and the implementation of the diagnosis. And today I will tell you only a few words about this diagnosis, because I will tell you more during the second webinar, because this diagnosis was extremely important, and I would say that it was the without this diagnosis we couldn't program the evidence-based assumptions of our preventive program, because this diagnosis was conducted in the two research subpopulations. One research subpopulation was consisted of the teachers from all over Poland, from the primary but also secondary schools. We had also a few teachers working in the preschools, in the kindergartens, but mostly they were the teachers working in the secondary and the primary schools. And however, the diagnosis was also implemented among the respondents. The research subpopulation consisted of the students, of the students, because we were focused on the teachers and the students as a potential recipients of our program. So we wanted to ask them about two main areas. But before I will tell you what kind of areas, I will also add that this research population of teachers was also important for us from the perspective that they could be also the potential further implementers of our program. So the making a long story short, because as I said, I will tell you more about this diagnosis during our second webinar. But it is important to tell you today that the diagnosis provided us the information of the two main areas. On the one hand, during the diagnosis, respondents were asked about the current state of radicalization issue at school and in the local environments. And on the other hand, the diagnosis was dedicated to the gathering the information, which is essential for the designing of the individual components, the components, elements, the standards of our preventive program, focus on the prevention of radicalization leading to discrimination and hate speech. So in this area related to the current state of the radicalization issue, because as I mentioned, we wanted to confirm in our research that potential recipients and the implementers of our preventive program, they really see that that there is the problem with the radicalization in the Polish schools and the local environments. I will just add that it was also done by us because for the last years, when currently we talk more about the necessity of taking the actions in the area of prevention of radicalization in Poland. However, still, when we try to plan more complex activities and to involve more partners in Poland, and especially the partners on the governmental level, very often we are facing the answer that Poland is not affected by radicalization, and there is no need actually to design and to implement especially long-term comprehensive programs. So this is why we wanted, as I said, we wanted to confirm our practitioners' expertise and the knowledge during the scientific process. And this is why we ask the respondents, the teachers and the students about how they see the state of radicalization issue in Poland. So we ask them about the types of discriminatory behaviors and also the other manifestations of the radical behavior that may be occurred in the past or currently occurring at the schools and also in the local environments. So then we ask students how they understand and with what they associate the term radicalization. And we ask how teachers and students assess the scale of manifestation of radical behavior in school and also in the local environment where they live or where their schools are functioning. Then during this diagnosis, we ask also about the risk factors, actually the causes leading to or potentially leading to the occurrence of radicalization processes at schools and in the local community. And then we also, in this part, we also ask about the activities which are currently implemented, carried out at schools in the area of preventing discrimination. This discrimination that can lead to radicalization, leading to discrimination and the hate speech. And we also ask in this part of diagnosis about the measures to prevent radicalization that need to be strengthened at schools where the respondents are working or learning. And then the second part, but integral part of our diagnosis, was focused and provided us the information, which is essential for the designing as I mentioned, the individual standards, components, element of our preventive program. So we ask in this part of diagnosis about the target groups that should be included in the anti-radicalization program. We ask students about the interest in participating in a preventive program to prevent radicalization. We ask them simply if they would like to participate, if it's needed to, in their opinion, if it's needed to prepare to design this kind of program, and if it would be designed, they would be really willing to participate in this kind of initiative. Then during the diagnosis, we ask them about the types and the forms of preventive tasks, types and the forms of the preventive task that should be included in the school program aiming in the prevention of radicalization leading to discrimination and the hate speech. It was again I will repeat it once more. It was very important for us to get familiar with the real needs and the preferences of the potential recipients of this program. Then we also ask both teachers and the students about the key prevention strategies and also factors protecting against radicalization that we should include, that should be included and emphasized in our program. And then we also ask about the entities. It means the partners with which the schools usually cooperate during the implementation of the preventive measures. And we ask respondents also about the local actors with, in their opinion, should cooperate with school in order to effectively prevent radicalization leading to discrimination and the hate speech. So this diagnosis was implemented. I didn't mention, I think, that it was implemented. It was conducted in 2021. We started in 2022 the preparation, and it was implemented, between 2020 and 2021 in Poland. Yes, and then having the results of this deepened diagnosis of the current status of risk of radicalization leading to discrimination and the hate speech in Poland, but in Poland thinking about the schools and the local environment, we had evidence-based material to start the third stage of our logical model. It means we were ready to start to work on the description of the long-term comprehensive program assumptions. So it means that we were finally ready to start this designing process of our standardized elements of our long-term comprehensive program. So at least a few times I mentioned about elements, about standardized components of a long-term preventive program. So I will tell you that in details. I will present you the process of formulating, of designing each standardized element of our program, Understand, Respect. I will present it during the next webinar. However, just to prepare you and just to give you the imagination, how we understand those standard components, standard elements of the structure of the preventive program. So I will show you it today. Actually, those standard components and the components, or calling them in the other way, elements of our preventive program. This is the set of compulsory elements which has to be included in the program description to call the initiative, to treat the initiative the long-term comprehensive preventive programs. It wasn't like that we were just sitting and thinking, let's do maybe this and this and this standard should be included in the structure of the program. Actually, this set of the standards visible on the slide was created by me as a result of the comprehensive research study conducted by me in the frame of the preparation of my PhD dissertation, which was related to the social determinants of the police preventive actions. So, because implementing the preventive measures in the Polish police, in cooperation, of course, also with the external entities, but also preparing the implemented preventive programs and actions by police officers, we observed, starting in 2015, we started to observe that we have many initiatives which we call preventive programs. However, they weren't the real programs because they weren't fulfilling the components in the structure, the elements that should be included in their structure to treat them as a comprehensive programs. And then, but just to, but it was again, it was the practical observation from the everyday work, and then the scientific process was conducted by me to see what kind of standardized elements we are talking about in Poland in the domain of the prevention of the security threats, but not only in Poland but also abroad. And then this kind of set of standard components of the preventive program was built by me on the basis of the material used by Center for Educational Development. This is the center functioning in Poland and dealing with the preventive measures designed and implemented in educational system by the schools, mostly by the schools. And this is the entity which is very well known in Poland and very much experienced in this in so-called school prophylactic. And they built a kind of recommendation system and showing and setting the standards and the criteria for assessing the quality of preventive programs, and mostly related to the mental health promotion. But not only. And this set of the standards and the criteria proposed by the Center for Education Development, it's very important to mention that it was deriving from the set of the recommendations and the standards and the criteria adapted, and it was adapted from the experience and from the practice of European Monitoring Center for Drugs and Drug Addiction, MCDDA. And when I conducted this very comprehensive study, I saw that actually we are missing in Poland the kind of set and a clear set of standards showing what elements should be included in the structure of the program. But we have a standards mentioned by me and implemented by the Center of Education Development, set of standards and criteria used for the assessing the quality of the preventive programs. So I decided to use the same criteria, because if those standards and the criteria are proper to assess the preventive program, which is already built and implemented, to assess the effectiveness, the quality of this program. So if we will use the same set of standards, standard components and the elements already during the process of designing of the program, there will be the definitely higher probability that going through this logical model of the designing of our program on the basis of those criteria, of those standards, there will be the higher probability that our initiative will be more efficient. So on the slide you can see the set of 13 standards that should be included in the structure of the long-term comprehensive program. Starting with the general data about the program, like a name, like a author, entity responsible for the implementation of the program, but also the program type, for example, educational or alternative of the mixture of those two strategies, and implementation period. Going through the description of the phenomenon, of the problem, which together with a short description of the diagnosis implemented in the local environment, including, of course, the causes, the roots, and the risk factors leading to this identified problem. Going through the element dedicated to the target audience, to the addresses of the preventive program, level of prevention, adopted scientific theories, and the preventive strategies, which we planned to build the ground for the planning of the tasks of our preventive program, but also the information about the protective factors, and of course objectives, together with the indicators which allow us to measure the progress of the program. Detailed description of the planned preventive tasks, of course, and also preventive entities. It means the partners who will help us to implement the program, together with the schedule and the implementation methods, how our preventive tasks planned in the frame of the preventive program will be implemented. And of course, also the description, very, very important, standard element dedicated to the ways and the dates of evaluation. And I think here about the three types of evaluation, including the formative evaluation, evaluation of the process. It means the monitoring of the implementation of the progress of program, and the evaluation of the results. And also element dedicated to the sources of information about program and the method, how we want to disseminate the information, how we want to communicate with the society, with the public, and with the other entities about our program. And of course, the element dedicated to the program's expenditure. It means the cost, how much we have to, how much money we need for the implementation of all planned tasks, and from which resources we will be able to get the funding for implementation of our project. So this set of standard components, elements of preventive programs, all of them, they are included in the description of PPHS program titled Understand and Respect. So in the stage number 3, which is dedicated to the description of the long-term comprehensive evidence-based program, those all criteria are described, and they were designed directly with a direct relation to the results from our diagnosis implemented in Poland and already shortly described by me. But as it's already nearly 15 minutes past 10, so we are having only 15 minutes left for today. So as I mentioned, this detailed process of the formulating the standardized assumptions of our preventive program on the basis of the example of PPHS program Understand Respect. I will very practically show you how the all assumptions, standardized elements were designed on the basis of the diagnosis. I will show you, I will discuss it, I will present it, and I will show you on the slides during the second webinar, which is set for 25th of July. I hope that and then one more thing, on the third meeting set on 22nd of August, I will stop a bit longer on the process of evaluation of evidence-based preventive program, because as I mentioned during the introduction to our today's meeting, that the Indeed project is actually very much focused on the evidence-based evaluation of PVE, CVE, and the radicalization initiatives. So I will allow myself to be, of course, during the next meeting, I will go through the all standardized elements, which are very important for the structure, for the building, for the designing of long-term comprehensive evidence-based program. But during the third event, I will be more focused on the evaluation, how this process of evaluation was planned on the basis of the logical model of the designing of our program, and how the formative evaluation was already implemented, and so I will share with you our expertise. Of course, if after today's meeting you will be interested in joining our event, those two additional planned events. In the meantime, between the webinars, I'm staying in touch with you. So if you would have had more detailed questions related to the already the stages of the logical model preparation of our preventive program, if you would be interested in more details, of course, there is on the slide you can see my email address. So please feel free to contact me.